The Big Ugly Bill makes a lot of changes to America's healthcare system over the next several years. Welcome to Care Talk Live, where we talk about how healthcare works or doesn't work in America and answer your health insurance and healthcare questions. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Please text or call in your questions at 202 838 6837 and we'll answer them in future episodes. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get next week's show. In today's episode, healthcare expert Rachel Madley explains what changes are coming to your healthcare and when those changes will happen. So, welcome, Rachel Madley, Director of Policy and Advocacy at the Center for Health and Democracy.
Thank you so much for having me, Laura. And I'm really excited to be talking today about exactly how this bill is going to impact healthcare for everyday patients, because it can be incredibly confusing to understand when everything happens and what those effects are going to be.
Great. So let's start with this bill was just signed into law a few weeks ago. What is happening right now or will be happening very shortly?
Great question. So there are three things that happened immediately after the bill was signed into law, which happened in July. The first is that it is now harder to enroll in the Medicare savings programs. These are programs through the Medicaid program that help low-income seniors and people with disabilities pay their out-of-pocket costs for Medicare, including Part B premiums and coinsurance. What the bill did was it prohibited states from automatically enrolling people who receive supplemental security income, or SSI, into the Medicare savings programs. Now, what that looks like in real life is if you are a senior, you are 65 and you make a low income, so you are enrolled in the SSI program. Normally, in 31 states, you would have been automatically enrolled in the Medicare savings programs, meaning your out-of-pocket costs for your healthcare would have been close to zero. Now, you are not automatically enrolled in that program, and many people don't even know that this program exists. And so there are going to be a lot of people who do not enroll in the Medicare savings programs and therefore are left with very large out-of-pocket payments for their medical care. The second thing that happened immediately is Medicaid payments that are newly established to hospitals and health facilities were capped at between 100 and 110% of the Medicare payment rate. And the payments that were over that cap already are going to be decreasing year over year. Now, what that means is that hospitals and healthcare facilities like nursing homes are going to see their Medicaid payments decreasing in many different states. What that looks like for patients is that these facilities may have to either cut back on their services or potentially close because they don't have enough funding to stay open and serve their patients. The third thing that happened immediately is that Medicaid reimbursement for things like cancer screenings, annual exams, and birth control from Planned Parenthoods across the country were stopped. Now, I will note that there is a court case that's working its way through the court right now, but as of now, Medicaid recipients cannot be seen at Planned Parenthood and have Planned Parenthood be reimbursed for those services. I should note that Planned Parenthood and a lot of other reproductive rights organizations are working to make sure that there is wraparound care for people who are going to be hurt by this. But just as an example, if you are a young woman in college and you use Planned Parenthood for your well woman exam every year and you're on Medicaid, you may not be able to get that exam now because Medicaid will not reimburse Planned Parenthood. So you're going to either have to find another provider near your college campus or just go without that exam.
Okay, so it sounds like the immediate cuts are to mostly Medicaid and people who use Medicaid, although, of course, we know that big cuts to Medicaid are coming later. And there's also going to be effects on the Affordable Care Act soon, right?
Yes, definitely. So, people in a few weeks will begin receiving their premium notices for their ACA plans for 2026, and they can expect that they will see their premiums increase by a median of 15% compared to last year. Now, this is on top of the expiration of the enhanced premium subsidies for the Affordable Care Act. So, the actual out of pocket costs that people pay for their health insurance premiums on the ACA could increase by around 75% each month. So let's say that you are a family of three and making roughly $110,000 a year. In 2025, you could have paid somewhere near $779 in premiums per month for your ACA plan, with those ACA subsidies paying for the rest. In 2026, you could see your monthly premiums jump up to $1,662 a month, which is a massive increase. And it is expected that a lot of families are simply not going to be able to afford that. So they may have to go without health insurance. And that will start January 1st, 2026. And I should note that there was nothing specifically in the bill about the subsidies, and that's where the issue lies because the subsidies are set to expire, and nothing in this bill is going to extend them or change anything there.
Mhm. And I am one of the people at risk. So I will be getting a letter in the next few weeks with my Affordable Care Act premiums for next year. And however much they raise it by, as a cancer survivor, I have to pay that. I can't go
Mhm.
without health insurance. So there are millions of Americans that are going to get a letter in their mailboxes soon with the
Mhm.
terrible news on next year. And this is because Congress failed to act so far.
And if I can just add, as someone who has been insured before and has type 1 diabetes, for people that are worried about what is going to happen next year, there are some things that you can start doing now while you still have your ACA plan, like make some appointments for your end of year because doctors can get very, very busy towards the end of the year. So try and get in before those premium hikes happen. You can also do things like refilling your prescriptions as soon as they're ready if you can do that financially, because then you might be able to have, a few days or a few weeks of extra. Now, this is not to say that this is what you should have to do, but these are things that you can do to try to protect yourself as we go into this, what I think is going to be a healthcare crisis.
Mhm. And so, you mentioned that there are cuts happening to Medicaid right now, although these are not the big cuts that are coming later. Uh, how can is this one of the reasons why we're already starting to see hospitals announce that they're closing? Is because of these cuts that are happening already?
Definitely. So that's one reason, but also hospitals are looking at what is to come in later years. For example, December 31st, 2026, in states that expanded Medicaid, they are required to redetermine a patient's eligibility 2 times per year now instead of 1 time per year. That is estimated to kick a lot of people off of their Medicaid. Again, not because they're not eligible anymore, but because if you are someone who is a one person household making $20,000 and you do your eligibility redetermination in, let's say, January, and then you move apartments, they're going to be sending you a second eligibility redetermination that, one, you may not be aware of, and two, may not make it to your new address. They may not have the correct email, phone number. And history has shown that when eligibility redeterminations are more frequent, call volume at Medicaid centers around states really, really increases. So hospitals in turn are not going to be getting these reimbursements from Medicaid because these patients are no longer going to be on Medicaid. We also have things like in October of 2027, there are changes that are going to be made to a wonky provision called the provider tax. I'm not going to get into what that is, but what it amounts to is federal funding that goes to states to administer their Medicaid program and pay for the healthcare for Medicaid enrollees is going to decrease by a very significant amount. And so all of these decreases in Medicaid funding from the federal government going to states and eventually to hospitals are leading to those closures. And research shows that over 300 rural hospitals right now are at risk of closure, and some have even started to announce that they will be closing, as you mentioned.
Hmm. So, going back over the timeline to make sure everybody is clear, Medicaid cuts are happening now. Affordable Care Act policy increases. You'll be getting a letter soon in the next couple months, and the policy increases go into effect January 1 of next year. And so far, due to Congress failing to act, if you have subsidies that help pay for your Affordable Care Act health insurance, that's going to skyrocket next year because the subsidies will be gone.
Mhm.
What else is going to happen in the near term? Because as you mentioned, some of these things are going to happen in 2027 and beyond.
Mhm. So, in the near term, there is also a provision where lawfully present immigrants who are refugees, have been granted asylum or parole, or certain survivors of domestic violence are no longer going to be eligible for Medicaid. And that is going to happen October of 2026. And I should also mention that there will be a $50 billion rural health fund made available in September 2025. Now, you may see that trying to be sold as something that will, solve the problems of these cuts. However, that's only 5% of the total cuts, and it's not estimated to be near enough to prevent these rural hospital closures. And I think in the near term, the result is going to be closure of rural hospitals, which means longer wait times and longer commute times if you have an emergency to get to a hospital. And that is not just for people who are on Medicaid or the ACA. It doesn't matter what health insurance plan you have. Closures of rural hospitals are going to affect everyone. The other thing we can expect in the near term is an increase in healthcare costs, because people who lose their Medicaid coverage are not going to stop having medical emergencies. And so there will be a rise in uncompensated care in emergency rooms. And that is made up for by our people who have insurance, by their co-payments and their premiums going up.
Mhm. And so you mentioned that something that people can do now, if they're not sure if they will have health insurance or be able to afford health insurance next year, is, see your providers, get, if you have any medications that are due for renewal, get that taken care of now while you have insurance to help pay for it. Uh, should people also be contacting their elected officials as these cuts continue to roll out? Because they need to hear what this means for everyday people, and how the lack of healthcare is hurting us.
Definitely. I would 100% recommend reaching out to your elected officials and telling them exactly how this is going to impact you, because a lot of the deepest cuts to Medicaid and to our broader healthcare system actually don't happen until 2027 and beyond. So, starting in 2027, there is going to be a decrease in funding for Medicare of 490 billion from 2027 to 2034. That's because of another wonky provision called sequestration. I won't get into that, but essentially, this bill costs so much money that the government is then required to decrease spending on certain programs like Medicare. That means that physicians may not be able to afford to continue taking Medicare patients because their reimbursement rates could be cut. Later on in 2028, there is an increase, or there's work reporting requirements for people who are on Medicaid. Now, this is expected to result in the most amount of people losing their Medicaid coverage, because people will be required to report that they have worked or volunteered in their community or something like that for at least 80 hours every month. Now, I'm saying reporting requirements because over 90% of people who are going to be subject to these requirements on Medicaid are already working. And it's not that people who are not working are going to lose their Medicaid coverage. It's that people who are working, but Again, do not receive the paperwork. The email is incorrect. The Medicaid offices are overwhelmed with instituting this new reporting requirement. They are going to lose their Medicaid coverage. And so the most drastic cuts are happening in 2027 and 2028. So there's still time for people to hear how this is going to impact you. But you can expect in the immediate term that there will be a lot of increases in out-of-pocket costs. So I think now is the time for people to be expressing exactly how it's going to impact your healthcare.
Thank you so much for joining us, Rachel. And for everyone that is listening and watching, we will put the link to Rachel's guide out there that goes into detail what exactly is happening when. So thanks for joining us. Thanks for everything you do to keep people educated on what these attacks on our healthcare are going to look like.
Thank you
And
so much
next,
for having me.
and next, I'm welcoming Diane Archer from Just Care and Social Security Works to talk about the latest news from President Trump and prescription drugs because he has made some statements recently. So tell us what is happening.
Yeah. So at the same time that lots of people are going to be losing their health care coverage, often the most vulnerable, the president is saying that he wants to make drug costs more affordable for people. And that's good news. In fact, he goes on to say that he wants us to be paying what people in other wealthy countries pay. But what has he done? And here, I think the actions speak louder than the words, because most recently he sent a letter to 17 CEOs at the biggest pharmaceutical companies. And what did he ask them? He asked them if they would reduce voluntarily the price they charge Medicaid for their drugs. And what does that mean for you and me and everybody else in this country, even people with Medicaid? Really no change in the price of our drugs. Because people with Medicaid do already pay low drug costs, and this doesn't affect anyone else. So that was a big news item that really was a lot of sizzle with no substance. There was one other piece that I will mention, which was to ask these drug company CEOs to directly sell their drugs to consumers at the same price as they charge people in other wealthy countries. That, again, is a voluntary act on the part of the pharmaceutical companies if they do comply, which is not at all likely. But even if they did comply, people would be able to buy their drugs without insurance coverage at a lower price. And they have insurance coverage that should be actually benefiting from lower priced drugs. They shouldn't have to spend money on an insurance plan that they can't use. So right now, President Trump has not successfully lowered the price of prescription drugs and the cost of prescription drugs for people. Unfortunately, the converse is true, because as health insurance premiums go up, more people can't afford their prescription drugs. And as no constraints are placed on pharmaceutical companies, they can continue to raise the price of their drugs. And what we're seeing now, one last comment, is that for the Medicare population in particular, Part D premiums, and Part D is the prescription drug coverage in Medicare, are set to quote unquote rise significantly with little help from the government to offset those costs. So all in, a lot of talk that's very good, but little action that is helping people whatsoever.
Thank you, Diane. And now, welcome Louise Norris of healthinsurance.org to answer more questions, including Anna's question, who wants to know what about all the people receiving Medicare and Affordable Care Act and Medicaid health insurance by fraud that has been theoretically removed via the budget bill? Shouldn't removing fraud, waste, fraud, and abuse help make up for the $1 trillion in cuts?
So CMS did publish a report last month saying that they had done an audit and identified about 2.8 million people who had duplicate enrollments. They were either enrolled in Medicaid or the Children's Health Program in more than one state at the same time, or enrolled in one of those programs and also a marketplace plan at the same time. And so they're taking steps to eliminate those duplicate enrollments, get people, like if you're living, you can only be enrolled in Medicaid in the state you're living in. If your enrollment is still active in the previous state you lived in, they need to end that. So that is good in terms of just doing an audit of those programs, making sure that it would be good to have more interoperability between those programs. Every state runs their own Medicaid program, so it would be good to have more oversight on that and make sure that when someone moves that they are, re-enrolled in the new state, disenrolled from the old state. That's all good, but 2.8 million people, we have to put this in perspective of looking at across those three programs, Medicaid, the Children's Health Insurance Program, and the Marketplace. There's more than 100 million people enrolled in those programs. So 2.8 million total, and that doesn't mean those 2.8 million people shouldn't be enrolled. They should probably just be enrolled in one and not, maybe not two states Medicaid. They just need to be in one state Medicaid program. So it's actually a very small segment of these markets of all those people who are in these programs. So yes, having more oversight, making sure that there aren't duplicate enrollments is great, but this is a very small fraction of healthcare spending. We are much more concerned about the sort of things Rachel was talking about going forward. People next year potentially just not being able to afford their marketplace plan because the subsidies, there'll still be subsidies, but they're on track to be quite a bit smaller than they were this year, which will just make coverage unaffordable for some people. And then especially once we roll into 2027, having Medicaid work requirements, all those issues with people getting disenrolled, even though they're supposed to be in the program, they're eligible for the program, but they aren't able to, they either don't get the notification or they don't know what to do with it. We saw this happen after the pandemic when they went through and purged a bunch of people from the Medicaid rolls. The majority of the people who got disenrolled were disenrolled for what they call procedural reasons, which means they actually had no idea whether those people were still eligible or not. There were just, the paperwork didn't get completed for one reason or another. So yes, there's a small fraction of folks who were duplicate enrolled for whatever reason. In some cases, it's not fraud. It's not that the people are trying to defraud the government. It's that, you maybe submitted your disenrollment notice. You thought you notified your previous state that you'd moved, and it turns out somebody didn't process it. You didn't know you needed to submit it. Sometimes people think they'll be automatically disenrolled from Medicaid when they move. That's not the case. So there's, when we frame this as fraud, it sort of makes it sound like it's very nefarious, and it's not necessarily that at all. And it is just a small fraction of what this bill is going to cost for sure.
Mm-hmm. Yeah. So to get back to Anna's main point, the amount of duplicate enrollments or whatever is so small compared to the 100 million people that are enrolled in these programs.
Right.
That
And the savings from this is very small compared with what this bill is costing. So that's why they're going after other things like, cutting a bunch of people off Medicaid with the work requirement and the twice a year eligibility checks, is to fund this bill.
Mm-hmm. Because also, the small handful of people that might be registered for Medicaid in two states, if they moved, they aren't actually costing the state anything of the state they left because they're not there anymore. They're not seeing doctors. They're not getting care. So you haven't really saved anything if you disenroll people that have already left the state.
Yeah, the one place where you could see savings is a lot of states use Medicaid managed care organizations. So they actually pay an insurance company a flat rate to cover everyone, even if that insurance company is then spending none of their dollars. Because like you say, once a person has moved out of the state, they're not getting health care in that state. So it is possible there are some state Medicaid organizations that are paying insurance companies to cover people who are no longer in the state. So it is absolutely good that they're going through and doing this audit and getting that all sorted out, but it is not going to move the needle on, overall spending.
Mm-hmm. And next, Diane mentioned earlier that Medicaid drug premiums are set to rise next year. So tell us more about that, Diane.
Yeah, so the issue is what's happening for people with Medicare and drugs. And what we know is last year, drug prices were going up significantly, and the Biden administration put in place subsidies to Part D insurers to help offset some of the rising costs and to lower out-of-pocket costs for people in Part D prescription drug plans. But not a lot, because people did see some premium increases as much as $35 a month, which was the maximum a drug company was allowed to increase their premiums. The Trump administration is continuing subsidies, but at a much lower level, and it is allowing drug companies to increase premiums by as much as $50 a month. Now, let me say here that the premium increases apply only to people in traditional Medicare who buy standalone prescription drug coverage under Medicare Part D and pay a premium for that insurance. In Medicare Advantage, most often, the prescription drug coverage under Part D is folded into the Medicare Advantage package. That doesn't mean that people in Medicare Advantage are off the hook. Prescription drug prices are rising. The subsidies the government is giving the insurers is limited. And the only question is how the Medicare Advantage insurers will offset the increases in prescription drug costs. Will they charge a higher monthly premium to people? If they're charging nothing, maybe they'll increase it. Maybe they'll take away an additional benefit. Maybe they'll raise copays on certain items. So it will be less evident that costs are going up in Medicare Advantage, but absolutely they will go up for everyone in Medicare as a result of the fact that the Part D insurers are saying that their costs are rising. One other point here is that there is some good news, which is that people with high drug costs are now limited to $2,000, which is still a lot of money, obviously, in out-of-pocket costs for their drugs, so long as their drugs are covered under Medicare Part D. The problem there is something that we've talked about before, which is that often people can save more money getting their drugs through mail order, Costco or one of the other companies, and paying the full price of their drugs than by using their Part D coverage. So the copay under Part D becomes higher than the full cost of the drug through a mail order company. So people in Medicare have to do quite a dance to figure out whether it's better for them to use their Medicare Part D coverage to even buy their Medicare Part D coverage, which is a good protection if they need a lot of drugs, or whether they're better off using mail order and getting their drugs from low-cost pharmacies in the US or even around the world.
Thank you, Diane. And we will keep an eye on what's happening with Medicare Part D and rising costs in Medicare in general. So thank you, everybody, for joining us to learn about the changes that are happening to our healthcare in America and when they will affect you and your family. Please text or call in your health insurance and healthcare questions at 202-838-6837, and we'll answer them in future episodes. Join us next week for more on healthcare in America. Be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.